Namaskar. Good morning, good evening, good afternoon. I'm Dr. Bharat Patodiya. Stomach cancer, one of the most common cancers in India. And there is so many myths. What is stomach cancer? What is the treatment? What is the stage? What is the implication of stage? What happens if somebody presents in stage 1 versus what happens if somebody presents in stage 4? This video will cover all your questions, everything which you want to know. So starting from the first point, what is stomach and stomach cancer? What is stomach? So many people have this misconception that this whole area of abdomen where food comes or where fat deposits is the stomach. No, it is not like that. Stomach, being medically people call it gastric, is a very limited part of this whole area. If you look into this picture, I am utilizing Wikipedia. This is the whole intestine area. The whole abdomen is here. But this orange color organ which somewhat fits in this area is known as stomach. Now, as with any cancer, this organ can develop cancer. Any cancer is basically abnormal growth. Abnormal growth means normally our cells divide, it stops when it is not needed. But if it does not stop, it just keep on growing, then it becomes a tumor. And when this tumor has a capability of spreading somewhere else, this is known as cancer. So stomach cancer developed here but gone to liver, gone to lung, gone to bone, somewhere else is stage 4 cancer. Now, stomach cancer can happen in any part. If you pay attention to this figure shows stomach opened up. So it can happen in either this wall, front wall, side wall, back wall, or somewhere it is junction of esophagus, somewhere here. The treatment lot depends on the type, location and stage. So it is imperative, it is very important to know all these things before we comment on what is the benefit of treatment. So if a cancer is picked up at a local place where it is only here, there is a high chance of cure. But if it is already spreading, then with present science we can only control it, we cannot cure it. Now at this point of time, people ask how to find out if I have a cancer or how to find out if I have a stomach cancer. So few things you should be important paying attention to. One is symptom. What is a symptom? Symptoms are basically the complaints what a patient tells us. I have a pain here, I have burning sensation here, I have fullness here. That is known as symptom, what a patient complains to a doctor. So what are the common symptoms of a stomach cancer? The most easy, or I should say most common, is patient complaint of fullness. So they can develop pain, they can develop feeling of bloatedness, they can develop that they are feeling not hungry, they are losing weight, or they are developing nausea. So they eat little, but they feel so much full they start puking. This may be associated with weakness, and weakness may be because whenever a cancer is there, it starts releasing blood. The blood goes into the intestine, from the intestine it goes into stool, stool comes black. So black colored stool you must not neglect. So these are the symptoms which you pay attention, and you can present to a doctor early. You may get your cancer picked up early. Unfortunately, stomach cancer usually don't get picked up early because the symptoms are pretty much vague. Nobody is having fullness of stomach or slight burning will think that I have a cancer. So mainly patient present when it is already reached to a stage where it is advanced stage, stage 3, stage 4. Now since we have covered how it presents, we should also know why it happens. And it is a common question. Unfortunately, in majority of patients, we don't have a particular reason why it happened. There is no one single reason why it happened. There could be multiple of reasons like acid reflux. It can cause changes in the nature of the stomach lining. Some patients have family history of cancer. So if there is a family history, if somebody has cancer in their family, they may be carrying some gene which make them prone to developing cancers. So these patients can develop cancer. What I have also observed is the diet which we are eating. Highly salted diet, barbecued food, smoked food can also attribute to stomach cancer. What could be the other cause of cancer? Stomach cancer is also caused by anything which irritates our gastric lining, like smoking, like alcohol, like highly spiced diet which involves pickle. Probably this is the reason why stomach cancer is common in certain parts of India where fecal consumption is very, very rampant. Now the important point which I want to emphasize right now here is there are multiple types of stomach cancer, but most common type is known as adenocarcinoma, also known as adenosine. There are other types of cancer also, for example cyst, for example carcinoid, for example lymphoma or sarcomas. Now these, except adenocarcinoma, all these other type of tumors are rare. The treatment is totally different. In some, like just surgery is enough, there is no chemotherapy required. In adenocarcinoma, we need to do a surgery, chemo also, and even then there is a chances of recurrence. Lymphoma, no surgery is required, only chemotherapy is required. So it is important to find out the type of stomach cancer. So next question is how to find out the type of cancer. So finding out the type of cancer, understand this. Whenever there is a suspicion of cancer, when we think that it could be cancer, we have to do two types of things. The first thing is finding out the stage. And stage can be found out by some type of scan. There are different type of scans. For example, there are CT scans. There are PET CT scans. You must have heard of FDG, PET CT. Then there are other types of scans also. These scans basically are meant for finding out if cancer is just at a local place, one place, or has already spread to other parts of the body. So these scans tell us about the stage. And as I mentioned, the next important thing is the type. Now this type is basically determined by something known as biopsy. What is a biopsy? So biopsy is a simple procedure in which a part of tissue, so if cancer is here, we remove a part of tissue and we send for examination. Now for a part which is superficial, you can see this is known as, if you see this particular pictures, you just Google biopsy gun on biopsy gun, you will find so many pictures. It goes into the tissue, we click a button, some tissue comes out, it goes for microscope. But this is okay for something superficial, or if cancer is already spread to liver, under ultrasound guidance we can do a biopsy from liver. But this is not possible in case of stomach. So if stomach cancer is suspected, which is not spread to liver or other parts of body, in that case we have to do something known as endoscopic biopsy. So if you take a look in this figure, there is a black color tube which goes from the mouth, goes up to the stomach, and the doctor with his experience will take a biopsy from that area where abnormal cancer cells are present. Just for your information, I will also show you how these cancer cells actually look. Can you take a look at this picture? It is an ulcer inside the stomach, and the doctor sees it from the center or from the sides. The doctor takes some tissue, send it for testing. So that is known as biopsy. On the biopsy, we do different tests, various type of tests, which we call as HPE examination or histopathology. And if you take a look at this picture, under the microscope we find out, are there abnormal cells? If there are abnormal cells, then we do further testing known as immunohistochemistry. So if you take a look on this picture, it is the IHC. So what do we find in IHC? IHC basically tell whether a cancer is showing some special type of protein or not. This is important because now we have special therapy, special injections, special targeted therapy which kill only those type of cancer cells which has certain protein being expressed. So if you see in this figure, there are brown things. The brown stain is CD10. So if there is an antibody which targets only CD10, it will go and kill these type of cancer cells. It will not have other side effects. Same way, there is something known as CD20. There is in stomach cancer specifically something known as HER2. So if HER2 is present on stomach cancer, we give therapy against HER2. Now that we have done everything, we have done all investigations, we have find out what stage it is spreading somewhere else, it is not spreaded, what type of stomach cancer it is, what is the treatment. So as I already mentioned in beginning of the video, the treatment depends on the stage. If it is stage 1 and 2, disease is only present here, we upfront do a surgery. We do a surgery and based on surgical report whether we give chemotherapy or maybe a radiation therapy also. If it is already spread stage 3, stage 4, so in stage 3 it is here, but there are lymph nodes around stomach which is showing activity, showing size and large size on CT scan. I'll just show you what are the lymph nodes. So if you take a look at this picture, stomach is here. Around the stomach, there are blue dots represented in this picture, which are lymph nodes. If these are enlarged, especially more than 1 centimeter size, or they are showing FDG avidity on PET CT scan, then it is likely to be cancer, and it becomes stage 3. In the stage 3, we give chemotherapy first, reduce the cancer size, and after that we operate. After surgery, we give more chemotherapy to kill any cancer cell present anywhere in the blood, somewhere else or something. So this is the treatment plan of stomach cancer. Now, the stomach surgery can be of multiple types. Depending on the stage, half of the stomach can be removed, full stomach can be removed, or sometimes surgery can also be done when complete cancer is not removed. But because cancer is causing pain, bleeding, some other symptom like nausea, vomiting, we also do partial surgeries in which cancer is not removed, patient will not be cured, but still patient's complaint can be reduced. This is known as palliative surgery. Palliative surgeries. So the intention of palliation is to reduce the symptoms. Now, people who are confused, I just mentioned FDG avidity. Watch out my other video on PET CT scan explaining what is the difference between different type of PET CT scan. In the chemotherapy of stomach cancer, there are 2 drugs which are most important. One is 5-FU. 5-FU, also known as 5-fluorouracil, and oxaliplatin. Both of these injections are given as IV route. IV route means from the veins. You cannot give it subcutaneously in the skin, in the muscle, or any other way. This is the only route. Sometimes when we are doing surgery in a situation where cancer is spread in the covering of the intestines, known as peritoneum, we give chemotherapy in the abdomen during the time of surgery and then remove it after 2-3 hours. Everything happens inside the operation theatre. This is known as high pack. Leave the full form. It is kind of experimental and it is not offered at all the centers in the world. There are minority of centers, very advanced to where this procedure will be available. So you should choose a center where you get operated very well. For a stage 1, stage 2 cancer, we operate directly and give chemotherapy if we find it applicable. For example, if patient is fit, we will give chemotherapy in stage 2-1 like situation. If patient is unfit, then we might choose only to do surgery in early stages. For advanced stages, what I mean by advanced stages is stage 3. I'll explain what is stage 3. In stage 1, tumor is only at one place, maybe smaller in size or bigger in size, but only at one place. If you see this figure which I am showing you, there are blue colored dot around this stomach. This blue colored dot is known as lymph node, perigastric, around the stomach, perihepatic, around the liver, perisplenic. All these are location of lymph nodes. These lymph nodes are visible on CT scan, PET CT scans. On PET CT scan, they give a light, we come to know, oh, they are cancerous. In CT scan, their size is more than 1 centimeter, we come to know, oh, this is likely to be a metastasis. So when lymph nodes are positive, it is known as stage 3. Chemotherapy becomes very, very important because it reduces the chances of recurrence. In advanced stages, like stage 4, I already covered this test like immunohistochemistry, based on which you can give special medicines. So the name of such medicines are trastuzumab. This is a medicine which was actually designed for breast cancer, in which HER2 positivity was there. HER2, HER2, also known as CERB2. Right? So now you understand how important it is to do the complete ISC. By giving these medicines, we actually can give benefit of a very targeted therapy in which patient is not exposed to chemicals, chemotherapies unnecessary. We can give targeted therapies. If these are negative, HER2 is negative, there is no point of giving these therapies. There are other tests also like PDL1. This is also a type of immunohistochemistry, but it is very specific for immunotherapy. What is immunotherapy? I'll explain you shortly. If you take a look of this figure, this is known as CD10 immunohistochemistry. There are other markers like CD20, PDL1, HER2 I just discussed. So in PDL1, your immunity, the immunity function, one of the immunity function is to kill abnormal cell, whether it is bacteria, fungus, whether it is cancer. Some of the cancers which has PDL1 high, start bypassing this immune function and start living in your body. In those situations, by giving PD-L1 drugs, you can reduce this inhibition of immunity and immune system start working against your cancer once again. But understand this, if PD-L1 is negative, the response is minimal. So we should not waste somebody's efforts. Now I want to show you this another figure. This is the page on Wikipedia which shows pembrolizumab as one of the agents. There are other agents also which get approved eventually. So this PD-L1 is the most novel therapy which we have against PD-L1 positive tumors. I have covered in detail about PD-L1 immunotherapy, their side effects, how to manage them, what to do in my separate video. I would like to say only one thing. Don't be afraid of immunotherapy. Immunotherapy can be given even to old, frail patients also because it does not have side effects of chemotherapy, of hair loss or immunity going down or anything like that. So that goes for immunotherapy. In a very rare situation, when a surgeon has cut a cancer, but after the histopathological report which comes after 1 week, 2 weeks time, under the microscope, the doctor realized that wherever the cut has happened, the cancer is almost touching the cut margin. So there is a possibility that there is a cancer cells remaining in the body. In that situation, we also give radiation to that area. Radiation is important to reduce the local recurrence. So here was the cancer. To reduce its chances of recurrence elsewhere in the body, you give chemotherapy, which goes through injection to the whole body, kill any abnormal cells. But local recurrence, right here, either you have to do a repeat surgery or you can give laser, also known as radiation, to burn that area so that any cancer cell in that location will be burnt out. So this is all from my side about stomach cancer. If you have anybody among your circle who is suffering from stomach cancer, or do you know anybody who needs information, correct, authoritative information on the stomach cancer, this video is for you. Please share it. We also have other programs like Cancer Ki Pathshala, where we dwell in depth about cancer, its management, what are the therapies. This program is also meant for nurses and doctors. Visit our website. We are always available for an online consultation for a second opinion. Don't leave any stones unturned in the treatment of cancer because you get limited chance to treat it. Namaskar.